Chairman Eilert?
Here.
Commissioner Brown?
Brown here.
Commissioner Hanslick?
Commissioner Hanslick is here.
Scott Anderson?
Scott is here.
Tracy Osborne Olchin?
Tracy's here.
Frank Link? I believe Frank said yesterday he was not going to be able to make it today. He had another commitment. Mayor Eric Michelson?
Here.
Becky Yoakum?
Becky Yoakum is here.
Julie Brewer?
Julie Brewer is here.
Stan Holm?
Dan Holm is here.
Thank you. And Chief Troy Reddick?
I am here.
Okay, thank you.
All right, thank you all very much. Just a couple of reminders. The Board of County Commissioners has a special session scheduled tomorrow at 3 p.m. Is that right?
1 o'clock.
1 o'clock.
1 o'clock, I'm sorry. Board of County Commissioners on Wednesday at 1 p.m. Then we have our regular meeting scheduled on Thursday at 9:30 a.m. The meeting tomorrow will be informational to update the Board of County Commissioners on the recommendations of the task force. And obviously, the Board of County Commissioners sitting as Board of Public Health will have to make final determinations in that regard. Today, we have three different activities to look at. One is the general plan. Second is the chart. And then third is an appendix which will identify the essential businesses that have been in place since the governor's stay-at-home order. And moving forward, those same essential businesses we will rely on. And then if there's any further explanation that needs to be made, there will be a section for that, depending upon the kind of non-essential business that's included in our chart. So let's start with the overall viewpoint, the plan. Are there any areas? I understand you all received a copy last evening and hopefully have had a chance to review it. Is there any area of that planning document that anybody wants to review or change?
Okay. Tracy?
Yes, thank you. I appreciated Joe and the entire team for getting this document out to us so quickly last night. That was really very much appreciated. I was able to share this with all of the chambers in the county so that they could get that out to their respective groups, and we were able to have a call this morning just to go through this and ask any clarifying questions, and there were several. On this particular document, really just asking for the kind of clarification that they're hearing from their businesses. One is clarity on enforcement, and I know we talked about this a lot yesterday about whether or not we wanted to be proscriptive, with musts and shalls, or whether we wanted to be more encouraging. But some of the feedback that I got from the chambers was really respective to, if we're just being encouraged to do things, there are going to be businesses that will likely not do that. And I know that, there can be social media pressure and people can vote with their feet, but if what we're really trying to do is to get people to follow established standards, then we might want to consider which parts of the universal guidelines we really do want people to follow, and make those a little bit more clear. And if there is an enforcement measure, we probably need to clarify which pieces are enforceable and how, and which ones really are truly encouraged in terms of the stay-at-home piece. And then secondly, with regard to phasing, I've had lots of questions about what that means. And I know that it really does depend upon the gating and the trend lines, but some of the models that we've looked at might say no sooner than. So, no sooner than May 4th would phase 1 begin, or no sooner than, whatever the date is, 14 days later, would phase 2 begin. And so that way businesses can prepare if they know they're in phase 2 or they know they're in phase 3. They know what the beginning date might be. No earlier than that date. They understand that it could be later depending on what the gating might be. So those are just a couple of thoughts that I had on this portion of the plan.
Okay. Well, to your first comment, this is just nothing analytical about it, just a general observation. But the first day at home, there was more educational than enforcement, writing tickets, forcing, etc. And that seems to have worked based upon what our trend data shows. I think it would be very difficult and maybe non-productive to indicate that police and sheriff's officers are going to be knocking on your door if you don't comply. Chief, can you comment on that? You may have a different point. That's fine.
No, I think, that's been the key theme as we've spoken about. I don't think there is and I can speak for the chiefs, we have been very consistent with that. The education component works. Now, if there is desire to have an enforcement component built into this for peace of mind, I was just, as that conversation got going, I was pulled up the previous health order to see what we had on there that was more or less our enforcement mechanism if once again, we wanted to go down that road. And it's, it's the social distancing stuff. It's, and that kind of a thing is what they put in there. I just caution everyone. I know it sounds good to some to have this enforcement aspect looming over this. But as these restaurants open, as these businesses open, do we really want our police department to go in there and police this? Because those phone calls will come. And I just caution us to do that. As nice as that may sound to some, that is not, I think it's safe to say Johnson County law enforcement, at least as we've like to think it, it's definitely taken us into an area we've never gone into before, just like other places are in the country. But we've had great compliance so far. And I just caution us from going down that road.
Comments or thoughts?
Chairman?
I think that's fair. Going back to the business community, I just wanted to bring up that feedback. And if that's the will of the group, I think that's appropriate. But I just wanted to make sure that everyone was aware that had been one caution. No one's asking for a lot of enforcement, but I just wanted to make sure that I shared that.
All right. Other comments on that subject?
Chairman?
Yes, Ms. Brown.
Yes, thank you. So on the topic of enforcement, I will say I couldn't be more opposed to the thought of law enforcement, whether that's local police or the sheriff walking into a restaurant or business and issuing citations or handcuffing people and walking them out. The backlash of that visual is so much worse than whatever was going on before it occurred. It also creates a flashpoint for people who are very ramped up right now and are very concerned about their rights being violated. So I would caution, as the chief said, I don't think that's a good idea. I don't think we should be headed down that road. And Chief, I'm not picking on you in this comment, but anyone who thinks that sounds lovely, I can't even fathom as an American that sending the police in to arrest people in a restaurant sounds good. So thank you.
Yeah.
Okay, thank you. So we have some hands up now. I'll start with Mayor Michelson.
Yeah, I want to agree with Commissioner Brown and the chief that nobody wants to see, and we certainly don't need to get into this document with language about police going into restaurants and handcuffing people. However, I don't want to swing the pendulum so far to the other direction. I think one thing we can all agree on is that the existing stay-at-home orders and those that were in place by the county worked. as well as we could have hoped for them to work. And let me remind everybody that those did have the force of law behind them. We fortunately did not have to invoke that, but those were rules. Those were restrictions, and the potential, and we talked about that path, the chief and Penny articulated it at the last meeting. There was a protocol if we had intentional, repeated violations for enforcement. What I would recommend here is that instead of reinventing the wheel, we just add one sentence. If this is true, that the intent of the task force is that these orders, if adopted by the commission, will be subject to the same enforcement protocols as the prior orders to the extent of the restrictions and limitations.
Okay.
Well, other comments?
This is Commissioner Hanslick. I would very much agree with what Mayor Michelson suggested. I'm looking here at the previous county emergency order of the local health officer, and the wording in there is this public health order directing individuals to stay at home. I agree with him. I think people need to know that, yes, of course, we're not going to send the police in to arrest people and put them in handcuffs. I think that's an extreme picture that's being painted. But at the same time, I think people should know that it is not a free-for-all, and you don't pick and choose which guidelines you want to observe, and that there is the expectation that these will be followed. And I think the way that it was handled and is being handled currently with the protocol that the chiefs have put together and the sheriff's office, I would urge that we put some kind of statement in there to that effect, that we will continue that same kind of I don't even know if I use the word enforcement, but monitoring or some other word. But I agree that we should make mention of it in this document. The other thing I was just going to mention is a real quick correction on the list of the White House opening plan gating criteria. Someone had pointed out to me under symptoms between A and B, it says and or in our document, and in the actual White House document, it just says and. So we may want to make that correction.
Okay.
All right, let's go to the enforcement. Because there are different viewpoints, we will take a roll call on it.
The other thing I wanted to mention on enforcement, hold on, Julie, just 1 second. As this document comes before the BOCC for approval, it will more than likely have a public health order attached to it that will make it in the force of law. We don't have that ready. I mean, that's just when it's set for approval, it'll have that with it. So, Julie, go ahead.
My comment around enforcement is I concur with the chief and with Commissioner Brown and Mayor. I would not want this to be punitive enforcement, but prescriptive enforcement, in the sense that as we reopen businesses, they may be honestly thinking they are doing what they should be doing, but maybe just need some guidance or somebody to come alongside them and to either verify or do corrective action. So I don't know if there's capacity within the health department to be part of that prescriptive support. But certainly enforcement in my mind is not a punitive action, but more of a prescriptive, supportive guidance.
Yeah, and I think that's the protocol that they have in place. In place a month or so ago. So
well, okay. Are there other comments? If not, we'll proceed.
There are,
Mr. Brown.
Chairman
Yeah.
Brown. So a couple of things. One, the authority statutorily to issue an order relative to public health is found in KSA 65-119. The enforcement arm mechanism statute that gives the authority to enforce 65-119 is 65-129B. That is prescriptive. I will also say that it is also restrictive. So that those who are interested in how this must come down should probably take a minute on Google and look those up and make sure you know. I also want to point out there is such a thing as your inalienable rights as an American and as a Kansan, regardless of what this says, regardless of any statute, that you have inalienable rights, and we cannot just trample on those and forget that as we're moving forward. I caution everyone on that. There's going to be litigation that comes behind this if we do. Thank you.
Other comments? Pardon?
I just said thank you.
All right, okay, well, let's take a count. We'll phrase the question as enforcement in or enforcement out. So give me one of those two comments.
Chairman?
This is Commissioner Hanslick. I guess I'm seeing it a little bit differently. What I'm suggesting, and I don't want to put words in the mayor's mouth, but something to the effect of that people will be held accountable for following these guidelines as per the procedures outlined or being currently used or being as provided by the chiefs of police. I'm not sure that it's as simple as enforcement or not enforcement.
If we, following the vote, if the majority wants something in, we can deal with that wording. If not, then we'll go on to the next. So,
Mayor, did you want to say something real quick?
Go ahead, Mayor.
Yeah, I mean, my suggestion would be simply to add a sentence that says we are going to abide by the same protocols that are currently in place for violation of the restrictions in this. And that's a recommendation from the task force, because as Chief points out, we and Commissioner, we don't have that authority, but that's an important part of these recommendations in my mind, is that some of them are restrictions, not just voluntary suggestions. Thank you.
Okay, thank you. Can we go ahead and call the roll? And it would be, I'm sorry?
Well, so just to clarify, is that what we're voting on, that we are recommending that we add that sentence? So a yay would be...
No, there is no specific sentence to be added. The general question is, do we want to add or not in regards to enforcement? So there's no specific sentence.
Well, but could we make a motion that we add the mayor's sentence? I think that would make it clearer for all of us.
Well, if somebody wants to do that, go ahead. I'm trying to move the meeting along.
Okay,
so,
I would make that motion then.
Second.
I would make that motion.
Seconded by Commissioner Hanslick.
Motion has been made by Ms. Olchen, is that right? Mm-hmm. Second by
Yes,
Commissioner Hanslick. Any questions on the motion?
Yes, please restate the motion.
The motion is to add the sentence, "These orders will be subject to the same enforcement protocols as the previous order."
Yeah.
Thank you.
All right. Again, the public health director, any order that goes out there, this is implied or contained therein. So, clerk, please call the roll. Sure. Mr. Connor.
Chairman Eiler.
No.
Commissioner Brown.
No.
Commissioner Hanslick.
Yes.
Scott Anderson.
No.
Tracy Osborne Olchen.
Yes.
Frank Link. Oh, sorry, Frank's absent today. Mayor Michelson.
Yes.
Becky Yoakum.
Yes.
Julie Brewer.
Yes.
Stan Holm.
Just want to clarify my no yes again. What the statement I just heard, keeping it as is, if I vote yes, I'm in support of that statement, keeping it as is.
So if you vote yes, you're saying you'd like to have a sentence added that addresses enforcement.
But I think his question
enforcement as
is
the current order.
Yeah,
The sentence that Tracy read is what what you'd be saying yes to.
would be want to add that sentence to the order.
So can I clarify something? So when it was Johnson County's order, that was the protocol that Chief described.
Yeah,
But
I was gonna
The
come in,
governor
Penny.
is different. The current state is different.
Right. Well, okay, let's finish the vote. Stan, if you vote yes, it means that you want something included specifically. Vote no would be to leave it out.
So I want to vote with the chief. Is he voting yes or no?
Well, I have I have a clarification comment if I could before we conclude this. I think it's, if we're going back to the previous health order, there was an enforcement capability built within that structure of what we had. Within that, and that's where Commissioner Brown's statement regarding the statutory stuff, the lawyers need to get involved to give us the capability to do that. And I've tried to talk about that a little bit within here. Whatever this document says, there was a lot of conversation regarding the enforcement aspect of things. And to be blunt, it got a little sideways because we have never gone down this road before. But we got it worked out to where there was a component to where we could enforce. We chose not to. My hesitancy with this document has been, it doesn't read the same. There's not the statutory wording that's in there. So regardless of what we put into this, I think there's going to have to be another document coming from the health department to do that. Now,
You're
what
right.
we're asking here is if we're wanting to have the previous process put in place, I just want to reinforce that this is not the document to do that. There's going to be a separate document from what I understand. There's going to have to be some people, law degrees that get involved with that to produce that document that would allow that enforcement capability. And I think these two need to be consistent, but I just want to be clear with that. Now, if we're going back to putting the previous process in place exactly as it was with those health department orders, there is a process in place that we can go with, but they've expired now as a result of this, as the time involved. But if the health department is intending to do that, or whoever approves those orders, the chiefs will be fine with that. Is that clear?
Can I add, I think I want to add to what Chief is saying, and perhaps what Mayor started the discussion with, is it seems like there's a desire to have the same intent. The legal folks are going to have to figure out how to make that happen. But if the motion is to get to the intent, we can figure out the legalities of it. And it's going to have to go to the board anyway.
Let's finish the vote. We have 2 votes left to count. Stan?
Why don't you do the police chief first?
All right, Chief. All right, Chief, what's your call? Or no on the motion?
You're muted.
You're muted now, Chief.
Are we muted?
No, he's muted.
Hold on.
Sorry, I was muted there. A qualifying yes, because what I think we're doing here, maybe with some clarification on the motion, if what we're doing is we're intending on producing another document that's consistent with the previous health order that provide us the statutory authority to take action, then it's a yes.
That would be the case. So, all right, 1 yes. Stan?
Yep. That's a yes as well.
Okay, motion carried. Will be added. What was the other item, Tracy?
The other item was just a little bit of clarity around the phasing, the 14 days. Some people are reading it to mean after 14 days, we'll start looking at the phasing, and others are reading it every 14 days. So my suggestion is that we clarify that a little bit, maybe with language that says no sooner than May 4th, phase 1 will begin, and then no sooner than May 18th, phase 2 will begin, so that we understand that it could be every 14 days, but if the data isn't there, showing the trajectory going, either being stable or going down, knowing that it could be longer, but we know that that we don't start thinking about it after 14 days, that we're already evaluating during that 14-day period. It allows businesses to begin planning.
The only thing I would say is that when you're saying, the way I'm hearing you say it, is that the health department won't start doing any type of surveillance until the next phase starts, and that's not true.
No, I know that, but they think that's what it means when they read the document. So that's why I'm asking for clarifying information.
But if you say no sooner than, then you've locked yourself into a position that may not be justified by the surveillance document or surveillance program.
Well, I guess that begs the question that we would move faster than 14 days, and I didn't think that was the case.
This is
Would
Commissioner
we?
Hanslick. I might suggest something along the lines of, given what we currently know about the virus, the public health officers will continue ongoing monitoring and provide input as to when the next phase would begin, with an expected average of 14 days or something along those lines. I'm not comfortable putting actual dates on this because we don't know if those would be accurate at this point.
Julie, go ahead.
In the document, under the subhead, phased approach to recovery, I had suggested an edit that the third graph down, after every phase, the Johnson County Department of Health and Environment will conduct surveillance to measure community impact. Listening to our discussion over the last few meetings, I felt that it would be clearer to say after initiating each phase, the Johnson County Department of Health and Environment will conduct surveillance to measure community impact, because it's my understanding that once a phase is initiated, that testing is kind of rolling, ongoing testing that will inform when we are ready to meet the next phase. I don't know if I'm comfortable with date specifics, but I will say from both the nonprofit sector and a number in the faith community sectors, some idea of what timing looks for each phase is something that has been a high priority so that they can do their planning and be ready to move to that next phase. If they fall in that next phase, it's kind of hard to know how to ramp up if you don't know kind of that time frame. The best guidance I've been able to give is we would anticipate phasing every 2 to 4 weeks dependent upon health data. But I don't know if that's too broad, and I would defer to Tracy and to Scott in the business communities to say whether or not that's too broad of a guidance. Thank you.
Okay, Mayor?
I'm agreeing with most everything that's being said, and I'm slightly uncomfortable with dates also, but I understand Tracy's point that some ballpark will be helpful for businesses to plan. I would urge if we do that, even with your hedging language, no earlier than that, we be more conservative. In other words, maybe May 15th, June 15th, so forth down the road, okay? So we don't create some false expectations. What is more important to me, and I would add it even to the same sentence, and this solves a lot of the other problems about when do we move between phases, whether hopefully that just goes forward or whether we have to backpedal at some point. An important assumption for all of this is that we let the Johnson County Health Department tell us when those gating criteria are met and that we can move between the phases. I see this task force's job is to describe what the phase looks like and set the criteria. But when those criteria are met, when we move forward, that should be to the health department to tell us. Now, I'm not under any illusions that that's an objective science, that that's a mathematical equation that will give us a precise date. There are opinions involved with that, but that is critical in my mind, that those opinions be the opinions of Dr. Ariola and Dr. Lemasters. And I would like to say that in this document in that same sentence.
Let me make this suggestion. I'm inclined there needs to be some level of specificity, and maybe there's something to the extent that every 2 weeks at least every 2 weeks, each phase will be reviewed before moving to the next phase, or some words like that. So there is a time frame. You've got the phase. So if I'm in phase 3, there's 2, 4, 6 weeks, something like that.
Dan has a comment.
I think
on that.
that's helpful.
Dan?
Dan.
Robinson?
Well, thank you. Well, now that the chairman's mentioned that, that makes sense to me. I think is the idea not that DHE will be evaluating this continuously throughout the event, and it's just that we won't that when we hit the mark where there's 14 days of the downward trend, then a decision would be made. It seems like that's the issue, or as the chairman mentioned, identifying that it will be assessed at a certain frequency. Either of those make sense to me.
Dan, I think you've hit it right on the nose. I think what concerned people was, in the middle of the last sentence under duration of phases, it's the phrase, given what we currently know about the virus, we will begin monitoring the impacts of rollback in each phase after 14 days. So even though I think we all understand that the intent is that public health officials will be doing this, almost every minute of every day during the phase, it makes it sound like we will wait until the 14th day to begin that assessment, which makes it seem like it will be far more than 14 days between the phases, when really that's not the intent.
Well, so this is Areola. I'll just provide Areola. I'll just provide a clarifying comment, and without swaying your decision in any direction. There's a reason for when you roll things back, you have to allow time for the rollback to play out. And the idea behind the 14 days is what we currently use as one incubation cycle for the virus. And so if you are tracking this a week after you roll back, you are not truly measuring the impact of the rollback. And so just keep those in mind without locking yourself into, but we're going to continue surveillance. It's our primary means of identifying cases and containing disease through contact tracing. But it's hard to imagine how you truly begin to see the impact of this before 14 days. Just wanted to throw that out there.
Oh, absolutely. I don't think anyone's asking for less than 14.
Mayor, you are the wordsmith. Can you give us a sentence along the lines that I described?
I'm not sure.
Something to the extent that each phase will be evaluated on a 14-day basis.
Needs to be reviewed on a rolling, continuous 14-day basis.
Yeah.
So
Yeah.
they're constantly.
yeah.
Let me take a crack at something here. So Tracy, to your point, if that sentence that I have highlighted was deleted, would that satisfy your, the folks that are having some confusion about what's intended?
Do you mind reading it, Joe?
Sure. It's at the end of where it says duration of phases. Given what we currently know about the virus, we will begin monitoring the impacts of rollbacks in each phase after 14 days. That was just removed.
Yes, I think it would, because we already reference that we have to have downward trajectory within a 14-day period under number 1. So
Right.
that absolutely gets to Dr. Ariola's point that if we haven't met that criteria, we're not moving forward.
Okay, so let's go ahead and we'll delete that and
Just
then
remove
back
it.
up to, the mayor was trying to reference about, I think it was this sentence here. Did you have some thoughts, Mayor?
Well, I would suggest, Ed's language as modified by Commissioner Brown to add the rolling concept with the qualifier at the end. It says that with movement between phases to be made upon recommendation by BHE. So I think that I don't know, let me know if I'm wrong. I think that captures it all. You know, we will be evaluating this on a rolling 14-day basis with movement between phases. With movement between phases based on the gating criteria as recommended by the BHE. That's my best shot.
Okay. Let me ask, is there consensus around that statement? Is there anybody opposed to it? All right, let's move forward with that.
Actually, clarification, because what I heard Dr. Ariola state, I apologize, this is Julie Brewer with UCS. Just a clarification from Dr. Ariola. What I heard you state is that a minimum of 14 days will have to be in each phase before you really do any meaningful testing to demonstrate whether or not an increase of cases have been generated by moving to that phase. Is that an accurate interpretation of what you just said?
I think that's very close to what I said. The gating criteria, again, using the White House gating criteria, and that's further down in the document, is looking for downward trajectory for a 14-day period. I'm saying that our surveillance is ongoing anyway, but to truly know the impact of your rollback on our numbers, you're going to need at least one incubation cycle. So while you have data for those times, they will not reflect the impact of your rollback. They will probably reflect what we have done in our current phase until then. So realistically, again, just so that when you talk to the community, realistically, to get your 14-day rolling average, you will truly begin to look at the number after 14 days. So to give people an expectation that you can move to the next phase after 14 days, it may not be the true reflection.
Okay, so I've tried to make some edits to the sentence. So please take a look at that while we're going through the rest of the questions. So Julie, do you have some other questions?
Well, my concern is just to have the language of a rolling 14 doesn't really capture what I am hearing, because I'm hearing that rolling has to start after the 14-day mark. And I guess my other, and it doesn't look like Commissioner Brown agrees with that interpretation, but I want some clarity on that so that we don't set unrealistic expectations.
To be clear on my idea about it rolling, it was simply that it is being monitored daily, the same way, Julie, that we're watching daily rolling information now. It's not that it should begin rolling at 14 days. It should be rolling from day one, rolling and keeping track of where we are and averaging, re-averaging, every day re-averaging until we've gotten to 14 days and we can look back. Then we know the full incubation period theoretically has gone past with some surety to move forward. That makes sense?
Yes, that's correct, and that's already what we're doing.
Yeah, so again, I'm trying to distinguish between those two functions in that the first sentence, this is how the health department is going to review data. The second one is determine improvement before the next phase is implemented, they'll use that same data. If that's not saying it, please make some suggestions on how it could be better.
Yeah, Joe, it's not quite there for me yet.
Okay. So go ahead.
The data review will be used to determine improvement before movement to the next phase is implicated, comma. With determinations as to when the capital G gating capital C criteria are met to be made by the BHE.
BHE for now, we can clean it up for the final. Okay.
BHE, yeah.
So BHE, tell me again.
DHE, Johnson County Department of Health. Sorry.
Department of Health. I'm sorry. I thought you said B. I'm so, new
I did.
acronym.
I misspoke. Sorry.
Hey, thank you. So
Okay. Go ahead,
I've got a comment here too. I've earlier in the conversation, somewhere along the way. So Dr. Joe Lemaster is a nice guy, and I think generally has done a good job of keeping us up to speed. But I also want to say that it wouldn't matter it wouldn't matter if the local health official was my dad. I don't want the local health official to have any more authority. The local health official has the authority to literally lock down the county. That's plenty of authority as it is. I don't see any reason to expand the local health official's authority. Thank you.
Okay, all right.
Stan?
Any other comments?
Yeah.
Stan?
Yeah, I just want to kind of separate two issues from the way I understand how we're supposed to be doing this. And I think we're combining the 14-day into two different buckets. So I just want to give you my impression of what that looks like, get Dr. Ariola's input on that, and then reread what you've just edited to make sure that it's what it's supposed to look like. For example, when we looked at downward trajectory, and we talked about it one of the prior days that we were in a task force meeting, there is a ongoing cumulative effect of a downward trajectory that you could use back about 10 days. The way this is reading, and I think Dr. Ariola and I were talking, yeah, it could be 5, 7, 10. It could be 14. So I just want to make sure that 14 is the cumulative rolling numbers that they're going to do ongoing regardless of what phase we're in, to ensure that very first piece, which is a downward trajectory. So park that for a second and recognize when we're talking about a 14-day phase minimum, when we were first talking about no sooner than 14 days, or no sooner if we start May 1st, no sooner than May 15th, and then May 30th, or whatever, or 28th, whatever we decide that 14th day is. The reason that 14th day is important is, and many of you know this, but I just want to make sure that's bucketed differently than rolling averages for 14, which is that if you do the herding in phase 1 that says we are now moving this grouping of people into the marketplace for business, why we need 14 days is the incubation, gestation, the cycle is usually 5 to 7 days is what they're indicating. And so most places are doubling that to 14 to say, are we getting some of those slow reactions in what people may be hosting this virus or not? And so that 14 days really is to see how is the herding going. And then to be able to say no sooner than X date, we should feel confident on that to be able to say that's the whole purpose of the 14-day. And then you roll out another group of the herding effect by more businesses, more contacts. And then you look at 14 days to say, how is that happening? And I don't mean to imply that no one on the phone knew that. I'm confident that everybody does. But I just want to separate the two on the cumulative rolling impact of data-driven information that we expect the health department to give us ongoing regardless of what phase we're in. And then the 14-day impact would really simply be, as we rolled out this phase, give it time for these individuals that are negative today and positive tomorrow, and that's a 5 to 7 day period, to start seeing impactfully, knowing that we shouldn't go into a next phase until we see the impact of that, quote, phase of herding, you might say. And that allows us to also look at the trajectory on a rolling or a retro cumulative effect for the last 10 days, no matter when it is. You could say on the 17th day, Dr. Ariola and Dr. Lemasters, what's our cumulative rolling effect for the last 10 days, whenever that is? Or if we now are saying with this writing, that 10-day cumulative rolling number is now 14, then I just want to make sure we're not mixing two things here. That said, Dr. Ariola, does what I just described make sense to how we might be mixing two different things here?
Absolutely. I will tell you though that you haven't seen that. We actually started plotting the graph now as a 14-day rolling cycle, just like we plot 3, 5, 10, just for these purposes. So we do have that. But again, so if I'm doing 14 days today, it's really a reflection of the last 14 days. So, but your point about the cycle, mostly 5 to 7 days, there's some slow reaction. That's the thing. To really truly see the effect and monitor that, you have to do it after you allow the changes that you have taken to have an effect. And that's the key point you're saying, yes.
Okay. Just wanted to add that. or look at how it's written and make sure it's what everybody wants.
Right.
Doctor, let me ask you that question. The current writing, are you satisfied with that?
That's
You hear my
fine.
question?
Yes, sir. Yes, sir. Yes, that's
Is that
okay.
okay?
Yes.
Okay, all right. Any other questions before we move on? All right, if there's consensus, we'll include that. Are there any other areas in that plan that needs to be spoken to and reviewed?
Julie, got your hand up?
Yes, yesterday's meeting, there was discussion around making sure, since this is a document that's going to be used for guidance for a lot of folks, and we talk about barrier masks, to include a definition of barrier mask in the document so everyone understands what options are available to them.
Appendix, Joe.
It's not, it wouldn't be in the appendix, but we could, I mean, I'm sure that there's a probably easy definition to insert here.
Okay.
We can insert that. I don't have it right this minute.
All right. Well, Stan, as I recall, that was your comment about barrier mask and trying to identify the very specific different masks that are available. Is that right?
It was, and as you can imagine, in the healthcare field, when it relates to medical grade masks, I've learned more than I could have ever imagined on the different brands, the different percentages, the different, when liquids are spilled on them. As long as the barrier mask is different than protection mask, and barrier being homemade masks and non-medical masks, I think that would definitely be the preference. And of course, many of these are more and more prevalent and available in the market to buy if you're not making the homemade masks that are non-medical. So I think I'm feeling comfortable. If we use barrier and you need a definition in the appendix, I'm just giving you kind of a parameter of what I would consider some of the definition in the appendix. But yes, perfectly fine with that.
Do you have access to a definition, Stan?
I can get that. I can push that to you.
You know, that'd be fantastic.
You bet.
I would appreciate that.
All right, good point. Other comments? Who's?
This is Commissioner
Commissioner
Hanslick. This is just a semantics. I noticed there are places in this document where we use the word "we" a lot. And I just would suggest that maybe Joe go through this to make sure that we either the word "we" is pretty clear who that means, or there's a rephrasing so that we're not using that word "we." I just don't like using "we" when we don't know who "we" is. So that's just a suggestion. Thank you.
I had gone through and there's a tracking changes version where I try to have consistency in taking out some of those that type of language, as well as consistency in residents versus citizens. So you might find in that tracking changes, a lot of that just little picayune stuff has been.
All right.
Did you say you have that, Julie, or did you?
I sent it out last night to you. I'm sorry, late, and then I sent it to the whole committee about the midpoint today. Glad to resend it, but it's.
I'm sure I have it, Julie. I'm just behind. So.
No worries, no worries. I just thought I would do some of that cleanup just to help us out.
Oh, that's great. I really appreciate it.
Mayor Michelson?
Just a quick typo. This may be in Julie's draft as well, but on page 1, there's a missing word. In paragraph numbered 2. After relaxed, comma, I think we're missing the word "this." This will most likely cause. I hate to take everybody's time with that, but I know we're pushing for a final document.
Okay.
Are you talking about this paragraph here, Mayor?
Mayor, no, this one, numbered 2. Number. Yeah. Relaxed, comma, this will most likely cause.
Understood. Okay. Thank you.
Thank you.
All right, any other items? Ms. Holton?
Yes, thank you. Just have had some feedback from others on phase 4 and the gating criteria for that being waiting on the vaccine. And we talked about this on the call yesterday, and just the ramifications of essentially holding seemingly kind of forever, or at least for a number of years, at groups of 100, or some businesses not being potentially open. And so just wanting to clarify if that really is our intent, to just wait on a vaccine when some categories of businesses based on capacity will be open with 100 people or more in them, and others will be held to not do that. And so I know we'll get into the specifics of some of those things when we get to the chart. But, you know, before we leave the definition of the phasing, I thought it was important to talk about that, and whether or not we still want the vaccine to be the criteria for phase 4.
My recollection was that the vaccine was speaking to the larger picture, not specifically to our phasing, but the fact that just the general knowledge that the virus may not be completely eradicated until there's a vaccine, and that the availability of the vaccine was not supposed to be directed to any phase of this program.
Well, then I think we need to change this wording in this phase, because otherwise it's going to hold back our ability to fully move into phase 4.
If it hasn't been changed, it needs to be changed.
Dr. Ariola, can you weigh in on that?
Again, I think that there's another way to achieve herd immunity. I think Stan spoke to that, assuming that the antibody that is generated from infection is actually a neutralizing antibody. And so if you have enough people that are infected over time, typically we like to get to 60–70%, and that happens through infection, then that might be the alternative. But again, I will say, not trying to shift the decision of the committee either way, I will say again, without a vaccine, based on what we know about the virus, and just again, listen to Dr. Bax, Dr. Fauci, this is very consistent with what everybody is saying. It's hard to imagine allowing contact the way that it was 6 weeks ago without a vaccine or some level of herd immunity. As long as you phrase that, if things remain as they are, no herd immunity, no vaccine, you can't open things back without appreciable risk to the public.
Well, I think, we cannot leave an impression with this document that businesses are not going to be able to open until there is a vaccine. That's the issue, and that needs to be clarified, quite frankly.
So, Chairman, this is Brown. I want to point out to the group, there's nothing out there that says a vaccine for this is coming. There are groups racing toward it, but H1N1, H1N2, there have been a myriad of diseases that have rolled through infections that they just ran through and became herd immunity. There never was a vaccine for them. There may never be a vaccine. Those words can't be in this document because there may never be one. In that case, large sporting events literally can never open. So that needs to be struck and rethought. I also have a question about, I heard there was a somewhere along the way, I don't remember who said it, but a comment about this applying to Johnson County citizens. But I've got a question. What do we do with a marauding group of Miami County golfers that show up in Johnson County and aren't following best practices for social distancing?
Well, that's up to the golf course. If they're not, then they need to be removed from the golf course, regardless of where their homestead is at.
Okay, but then to shift it to, they're standing in the middle of the intersection at College and Quivira. What happens then?
Well, if they're there illegally, then they will be arrested and removed.
Yeah, I think
Do you have something in mind, Commissioner?
Well, what I'm saying is that when we put restrictive words in, that we've refined it down to, if it's just applies to Johnson County citizens per this document, which by the way, I happen to think is completely illegal, but as a sidebar, does it apply to everybody on earth? Does it apply to everybody in Johnson County? Does it apply to everybody in Kansas? How do we enforce that in Missouri? There's a very slippery slope when we start messing with that stuff. So,
Commissioner, if I may, in the tracking changes, because technically when you look at the chart for phase 4, the only change between phase 4 and phase 3, in phase 3, we have all the different categories open with some guidelines. Phase 4, we have everything open at full capacity. So the original wording on this document, this number 5 that we're looking at, did not really reflect accurately what the chart was. So I recommended rephrasing of this number 5 to all categories of businesses will be allowed to open at full capacity when the gating criteria are met. This phase will most likely be associated with availability of vaccine and or therapies for COVID-19. So one, all those businesses were already open in phase 3. They were just open with capacity limitations. I would concur the other limiting language in phase 4 we may want to look at in the chart is, and we do say this, gatherings in phase 4, we say gatherings over 100 are permitted. So once again, those gathering size, to me, that's a little bit of a separate issue that I'd like to discuss when we get to the chart. But technically the chart already has everything open in phase 3 with some, boundaries, and then phase 4, everything's open without boundaries. So I just felt the phrasing in the document was not reflective of the chart.
thank you.
Okay.
So are we going to take out the vaccine? I guess I just want to get back to the document. If we really don't think a vaccine is coming, we should take it out.
Whatever implication
Yeah.
that businesses cannot open until after the vaccine is available, that reference needs to be changed. And so, Joe, what do you have?
Well, I just wanted to make one clarification. I think Commissioner Brown on H1N1, I believe there was a vaccine for that. I just going back to my health department days, and we had multiple clinics and running kids through there for that vaccine. So there was one developed for that one. And I guess, the other point I would make is maybe looking at phase 3 and looking at the, instead of saying 100, would it be better to say a larger number for the gathering side to help the businesses that have larger venues sooner?
Well, let's focus on the vaccine issue. How can we change that to not imply that businesses have to stay closed until there's a vaccine?
Didn't Dr. Oriola have a recommendation? I'm not sure if that.
Yeah, I think what Julie said last is actually the way to do it, because a lot of the businesses are opening at some capacity in phase 3. So if phase 4 is about full capacity, the other option, which I think is what Penn is referring to, is you can change that to until we have evidence of herd immunity or vaccine, because the herd immunity in theory can be achieved in other ways. I guess my point is to open up a football field for Kansas City Chiefs, given what we know, without herd immunity or vaccine, will be putting our residents at risk. So, but I understand why you don't want to say they can be open indefinitely. So maybe there's a way to rephrase that.
Okay. Then we're in agreement that a change needs to be made in that wording. Is that right? Okay. If not, that a change will be made. So other items?
Are you going to mention the public input?
Well, we'll come back to that. Okay, let's go to the chart.
Well,
Oh, quite a bit.
Pardon?
Commissioner Brown, go ahead. You're muted.
My mistake, Joe. Sorry, I meant to take my hand down.
Julie, did you have anything else, or you're assisting your hand
Yeah,
up?
just one other consistency change. We discuss in the phasings. Originally, we only mentioned wearing masks in phase 2. So I added it I also added that sentence to phase 1, masks will continue to be worn and other physical distancing will continue. Just because we talked about it in the current phase, we dropped it in phase 1 and we picked it up again in phase 2. So I thought for consistency, we should add that language to number 2, phase 1. Masks will continue to be worn and other physical distancing will continue, just for consistency's sake.
We use should instead of will.
No problem with that.
Impossible to enforce people wearing face masks if you say will.
Amen.
All right.
Okay, I did just want to mention before we get to the chart, just real quick, we've been trying to come up with some frequently asked questions about the task force activity. As you're well aware, you've all gotten individually some, and we've gotten quite a few here also. So we are developing these frequently asked questions and some of the answers. Just kind of wanted to show you kind of the general areas about.
And Justin sent it to the top.
Yeah, and Justin, Carol should have sent that to you. Questions about the phases, business or sector-specific questions, enforcement, testing, at-risk populations, and requesting resources. So those are kind of general categories. We'll put this on our website. We'll continue to add to it as we, as we get more information in. And just a kind of a summary of the feedback from the email. So salons and barbershops, gyms, pools, and there's just overall other health services, restaurants, and bars 4. So so far from the ones we've been tracking are generally those are the general categories we've been tracking so far. So just wanted to show you those.
And it seems very consistent with what a lot of the task force members have brought up so far. I mean, just the topic areas anyway.
Okay. All right. Thank you. Moving to the chart, are we ready to do that?
Yes, sir.
All right.
I did want to just mention one error that it's been pointed out to my attention previously, and I know it's showing up in people that are watching this. If you look at phase 1 under gyms and fitness, this is a change from yesterday. Open for business with guidelines implemented. I just simply failed to carry that forward to phase 2. So that's just a typo on my part. I just want to make sure to disclose that up front. So that change will be made.
Joe, so my printer broke and I'm waiting on a new one to arrive. So I'm at a little bit of a handicap here. I'm just trying to keep up with this is a lot harder in the digital world than it is with a piece of paper in front of me. But so from that perspective, I just want to make sure I understand. So gym services, whatever that entails, are a part of phase 1 opening and with restrictions. Is that what specifically it says?
It says open for business with guidelines implemented.
Yes.
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 And then I simply failed to carry that onto the next phase when I was typing this up last night.
Well, it is what it is, and Joe, we're all human, so I make mistakes. Everybody does, but I will tell you, thank you for fueling the 125 emails for me.
He probably has that times 5.
Not my intention, Commissioner, I can assure you.
Well, I've had that same experience of constituents reading a prior document rather than the current one, so I understand that.
Yes.
It's hard to keep up sometimes.
Yeah,
so.
More hands.
Okay, did you have any opening comments, Chairman? We could get to the...
No.
Okay, Mayor?
One typo and then 2 substantive comments. In yesterday's session, we took out the word commercial from that column, retail stores and commercial businesses, and then it found its way back into this draft somehow, Joe. So unless that was intentional, which I suspect it wasn't, can we get that deleted at the top of the column there? Yeah.
Yeah. I'll have to do that individually on each one, but yes.
Okay. You had other items, Mayor?
Yeah, I'm hearing a lot about 2 categories that we did not specifically address. I don't know that we need specific columns. Maybe we do, but it'd be great to get the task force understanding about hotels and churches and where they might fall under this rubric.
Well, I thought hotels were part of essential businesses in both our previous order and the state's order.
Okay.
Is that not correct?
No,
I'm
that-
sure they were considered
Correct.
essential businesses.
That
Right.
that was good.
Thank you. That clarifies that one. And then churches, I know that's a hot button topic and subject to pending litigation, but I am getting asked for guidance on that one.
Well, again, I thought that if you look at our chart, we tried to address, again, I think churches were allowed to remain open under the governor's order, but subject to the gathering size. And so, as we listed gatherings, I've got it shown here, the gathering size includes meetings, religious services, weddings, as examples.
I will say though, Joe, and I sent out, this is Julie with UCS. I've also, when we did a Health and Human Service survey last week, just to get an agency perspective on opening and some barriers, we had faith communities that of course are service providers as well, start to ask broader questions. And so they, and I sent an email earlier today of just some more specific questions that they have. So unfortunately, where they fall in this column, I don't think really gives them enough guidance. So that might be something that additional guidance may need to be given to churches so they understand what amount of flexibility they may have and also what type of cleaning they need to be doing between services if they were to choose to do smaller gathering, more frequent services throughout a weekend. That's some of the questions that I sent to the group. I don't know if we have time to consider that, but certainly if there's an opportunity as we do cleanup on the document to be reflective of maybe some of the things we've decided could give them guidance as well. Thank you.
Okay, I think it's really a challenge to get into particulars in regards to the churches with the, and I'm not an attorney, I don't know all aspects of the lawsuit, and what the judge determined on the governor's order. But again, my sense is that most congregations, if not all, have been exploring or acting on alternative methods of communication with members. And if there's some broad statement that recommending that should continue, why, I think that's probably the best we can do in that regard.
Commissioner Hanslick?
Thank you. Yes. Couple of requests for clarification in the wording and then a question or concern. I'm looking at retail stores and businesses, and it takes you down to number 3 at the bottom, and it says any retail store or business, for example, floral shops, pet grooming. I'm wondering if floral shops shouldn't be used because they actually are open for delivery. So that might be muddying the waters a bit because they are allowed to be open for delivery. So that might not be the best example of a retail store or business opening up. And then also, sorry?
Well, this allows them to open up for full business activities.
Yes.
Just not retail and,
yes.
Delivery, et cetera.
What I was trying to get to with that is just these are random examples of what kind of businesses are we talking about? We're talking about everything.
Mm-hmm.
So if there's a better description, that'd be fine. If I could take those examples out, that's fine too. But I thought that we were trying to put some kind of,
Sure.
just to show what's there. So I'll do whatever the group would like.
I think examples are good. I just wanted to point out the floral shops are kind of already open in a certain way. But
The price shopper.
Yeah.
yeah. And then on the sports venues, your youth sports and pools, the reference to number 4 at the bottom in terms of includes indoor and outdoor facilities as well as pools / spas located within businesses. I was contacted by someone who actually works at a medical spa. It's the kind of place where people get Botox or laser treatment or different kind of facials. And her concern was she thought that perhaps that number 4 was applying to them. So I would suggest that we, instead of pools / spas, that it be pools / hot tubs and saunas, or something to distinguish it from what some people consider a spa, where you actually have invasive treatment to your skin.
Just say within those facilities, to reference back to the indoor and outdoor facilities instead of businesses.
Well, the medical are already essential businesses.
Something
Right.
Something like that, Commissioner?
I guess I would just suggest, instead of using the word spa, use the word maybe sauna. Or have something behind there that says, as a medical spa, as opposed to a medical spa. Scott, did you have an idea?
Well, I do. I think part of your concern is just the use of the word. The use of the word spa has a lot of different contexts.
Yes, exactly.
For example, Lifetime Fitness has a spa that includes hair cutting services. Whenever, it looks like gyms and hair cutting. Well, they also have massage there. So I presume, there could be some, I'd probably say pools and hot tubs and leave it at that. I think that's sufficient. But I understand your point, Commissioner Hansel.
Okay. All right, so noted.
Stan, Holm?
Yeah, I know that I had my hand up for a while, so it's not relative to that specific topic, but just broad stroke, as we're looking through this, I thought it was important that you all knew that I reached out to the other CEOs of the health systems in Johnson County and had indicated to them that there's been a push on our latest versions to have more openings in phase 1. And all of them had agreed that they were fine with that as long as we did the social distancing, their normal guidelines by their industries to phase, kind of have that sub-phasing of how they're going to approach it. So just want to give you that broad stroke from the health systems perspective on that move to put more in phase 1.
Thank you.
Very good, Stan, thanks.
Tracy?
Thank you, Mr. Chair. Just a couple of clarifications that I received from the chamber execs, wanting to make sure where definitionally things might fall within the restaurants. And I think Scott and perhaps the chief could provide some guidance. They had particularly their smaller organizations asking these questions. When we talk about 50% of that inside capacity, they wondered if maybe we are interchanging the words capacity and occupancy, if we can address that perhaps in the definitions. And I don't think we need to wordsmith that now, but we might want to have that reference because I think some people may look at capacity differently than they look at their actual occupancy. And
I think occupancy is the right word, quite frankly. The owners, the operators, that's occupancy is a word that should be used. You're right.
So that was.
Chairman, if I might add, I think we had talked about using fire code. We may want to use that determination in there so people know what we're referring to.
Well, I don't know what occupancy number is reflective of. Is that fire code, chief, or is it something else? Square footage.
Yeah, I think we mentioned that the other day. I think that was what we were going to use for that. The handy part of that, and I spoke with our fire chief about that, is that every business should have that number, and it's required to be posted as well. Yeah, so it's
good point.
Handy.
So noted. All right. Was there something else?
Yes, a couple of other things, and I know we're going to, we could probably spend all day and all night coming up with what are the questions of certain different kinds of businesses that may not fit easily within these categories, like Topgolf and Pinstripes, you know, places that serve food. So they're quasi-restaurant, they're quasi-event space. They also are non-contact sports. So which category would they technically fall in? So, you know, we could talk about those and figure out, you know, where they could operate, because that would actually make a difference within the phases. But the larger question is also, who do we send people to? I know when the original stay-at-home order was put into place, you all had a hotline from the county, and then I know that Joe was really the arbiter of a lot of those questions. And so are we going to follow a similar path this time for businesses that are not really sure where they fall within this chart?
Call center is ongoing.
Yeah,
It continues to this day.
we had enacted toward the end there, kind of a group of the health director, the health officer, our legal department, and our office to try to address complaints as they come up. So we would anticipate doing that again. That's a really good point, Tracy. I think we'd be
because I know
Right. No,
I've been getting a lot of these calls, and you know, we've got several on, so I don't know if we want to discuss them, because it's not just an Overland Park issue. I know that we've got them throughout the county, you know, these groups that could fit various categories, you know, whether they are more restaurants because they serve food, or event spaces, or if they're entertainment, and it really does make a difference which phase they fall in. And then you've got,
you could do a list of things that are in question that team could look at, and then others could send in a list.
Yeah, the call center will be open. There are going to be questions, probably a lot of this and maybe some other issues. So that service will be provided. So I think I would suggest if there are interpretive things that need to be done, send those to Joe, and they'll be passed on to the call center so they can be prepared.
Yeah, that'd be great. Thanks.
okay, that's helpful.
Okay.
Appreciate it.
Okay, Dan Roberson.
Thank you. Yes, this may fall into the category we just talked about, but just before our meeting, I received a call from Jeff Stewart, Executive Director of Johnson County Parks and Rec, and he asked which of these categories would children's day camps, summer camps fall into? And I know in the White House version, camps are lumped with schools, but we don't really have that divided out. Do we have a spot for that?
I think that could. Yeah, Joe.
I was just going to say, the committee would probably need to take a look
Pardon?
at that. The review committee.
Yeah.
Okay.
Yeah.
Don't you think? I mean,
Yes. Yeah.
Thank you.
Thank you. Commissioner Hanslick?
Thank you. The question I had is where we say that various places can open for business with guidelines implemented. Am I understanding correctly that we will have appendices that relate back to each of these categories that provide an overview of those guidelines? I'm trying to understand that, because I've had a lot of questions from people saying, what does that mean? And for example, especially lots and lots of questions from the hair and nail salons saying, what does that mean that if we open in phase 1 with guidelines implemented, what does that look like? So how will people know what those guidelines implemented looks like for their particular industry?
Commissioner Hanslick, that's in the works. You're right. We're working on that, and we'll be sharing that as soon as they become available. There's a few of them that has been populated, but as you can see, there's a lot of things going on simultaneously, but that's the intent, and we're working on that.
Well, I appreciate that. Thank you. And I just want to take the opportunity to I know that we voted on it yesterday, but I'm still very, very concerned about having hair salons in phase 1. I've had a lot of calls since yesterday from stylists who are very concerned that that it will be very difficult to follow the guidelines we discussed of only haircuts. In fact, some of them said they don't do only haircuts, or they do coloring, or they do other services which would not fall within those guidelines. So I just want to state that I'm still very concerned about that being open.
All right, thank you.
Thank you. Julie Brewer?
Yes, I would like to speak in generally under the all residents column. When we get to phase 3 and phase 4, the language we use around continually and consistently through all phases to encourage seniors and vulnerable populations to stay at home. I think at some point in time, we have to be realistic, and we have to think of social isolation and mental health, and to consistently just inform seniors that your best bet is to stay at home, and thinking that is our fastest growing segment of our population. We might want to be thoughtful in phase 3 to phase 4 of rethinking that language. Especially if we may find ourselves in a cyclical pattern where we may have to reinforce the stay at home at some point in time. We all hope that we won't ever have to do that, and that our phasing will keep us from having to do that. But I feel like we have really haven't given them any hope on current situations changing, and that concerns me a lot.
Do you have a suggested language for that, Julie?
Well, I've seen in other phasing plans that in phase 3 and phase 4, it's more of language around interactions, maintaining the social distancing, and that just to leave the stay at home as their only opportunity for action is so limiting. I think you have to start to think about social distancing, and quite frankly, you have to think about them as a consumer group. And so I'm opening up a restaurant, I'm opening up some of the salons, I'm opening up these interactive with the guardrails and the special considerations. But for one whole segment of our community, 65 plus, which is our fastest growing population, to give no other guidance throughout all phases but stay at home is, as someone who's nearing that age, not too far.
For a while, Julie.
I don't know. The grays are coming fast and furious, so I feel closer. I just feel that is very limiting, and I'd like us, and I'd love to hear from Dr. Ariola, maybe some guidance on is it appropriate in phase 3 that if I'm a healthy senior, that I can rethink what my options are?
And this is Ariola. I couldn't agree with you more. I think that's always the dilemma. I was having the same conversation with somebody today. At some point, I think encouraging seniors and people with underlying conditions to wear masks and be more careful and following social distancing things are things that we have to do, because the impact of social isolation, even seniors in our long-term care facilities that are by far the most vulnerable, we can only shelter them for so long because there are negative consequences to that also. Yeah.
This is Commissioner.
It seemed to me like if we can include some broad language that, necessities, medical needs, and other health issues that need to be addressed should certainly be done or accomplished, something like that, so that there is no misunderstanding. But I know some seniors who have immune deficiencies or other diseases are going to be very, very careful about going outdoors or mixing with any level of crowd, and so we should not discourage that.
So Commissioner Hanslick, then Commissioner Brown, and then Stan Holm.
I just wanted to echo what Julie is saying. I've also heard from seniors and talked to one person yesterday in particular, and I think this goes in some part to some of the things Commissioner Brown has said. She said, look, I'm a taxpayer. I support parks. I support all these things, and you're telling me I can't use them? that doesn't seem right. And so her request was, could there be special, if it's necessary, are there special times where seniors could go to certain services, or that we're not, as Julie said, we're not just telling them throughout this whole process, stay at home. So I strongly would ask that staff look at changing some of that wording as we move into the, especially phases 3 and 4, of how we can accommodate and allow our seniors to participate in life outside their house in a safe way. So thank you.
Well, if a senior citizen asked me that question, I would say certainly you're entitled to get out to the park or walk your neighborhood or whatever. That would be my response.
Thank you, Commissioner Brown.
So I want to circle back on a question that came up at just a couple of minutes ago, having to do with hair care and salons. I want to be really clear with the whole group. I don't know who receives what, and honestly, they've come so fast and furious, it's even hard to keep track of, you know, who's in the group. When I started out with this, I would look to see who else got this, so I knew who to forward to or not forward to. Then it came so fast from all sides and every angle that I gave up on that, and all I was doing was reading them and trying to respond to particular ones. That said, I have had an overwhelming number of salon owners and stylists say they want to be open immediately. So while there also has been a drumbeat from the other side that says they don't want to open, that is not a one-sided message. That message has come loud and clear, and I don't know who else has gotten it, but it's been very loud and clear to me that there are owners and stylists together across our county, and I do mean across the entire county, that want to be open. So I just don't want it to stand that somehow the entire industry is against it, and so we're, you know, and if we open, we're forcing the whole industry. That is not the case. I don't know what percentage it is one way or the other, but I know that it's not all against by far. Thank you.
You know, the key to I think any success is the socialization and the distancing, and it is a real challenge. I had an email from a stylist, or I'm not sure that's the correct definition, who would have to spend 2 hours at a time in a small space, almost face to face with the customer, and expressed concerns about that type of situation. So, you know, there are variations across the board, I think, but you know, social distancing or physical distancing, I think, has been a key part of the success across the county in mitigating the virus. So we should keep that in mind also.
Thank you, Stan Holm.
Yeah, a couple of comments. First, I did see, Joe, where you put in phase 3 under all residents, especially as that was a great comment about our seniors and vulnerable populations to just follow social distancing. So I think we all will need to confirm that that's where everybody wanted to head. Number 2, on any of these businesses where, you know, in the healthcare world, it's social distance, 6 feet, 6 feet, 6 feet. And in our details, it also means that, you know, I technically inside a health system can walk around without anything, as long as I'm not under that 6 feet for any more than 2 minutes, and some say 10 minutes. So there's that 2 to 10 minutes without any protection. So the thought would be, if you're going to look at the nail salons and have those guidance for them, and they're going to be under 6 feet in any environment and more than 10 minutes, then that encouragement for them to follow their guidelines to protect themselves with PPE would follow. And wearing a mask to do that, and wearing other types of things or sanitizers tied to that, would be prevalent in what they need to do. Which goes to my final comment, which is, when I heard earlier that we're developing guidelines to be implemented, I actually thought, and I just need some clarification, that we were not going to get into the details of creating guidelines for each of these segments and industries. My impression was, and maybe there's clarification we put across this document, was that every industry and every sector of an industry would try to follow their industry best practices and their industry-led guidelines as best they can, and that we're going to put that type of language in the appendix, that when we reference guidelines, it's simply that you will follow your industry's best practices and those guidelines. And then we were going to give some examples. For example, Scott.
Amen, Stan. Amen, brother.
And I understand Scott was going to give as a great example for restaurants that we put in appendix, but that's really more of an example so that if they have nothing to look at, we can give them some examples, but that we are going to not run through that fine line of delineating all of these for everybody. Is that correct?
That is correct.
That's the impression I'm still under, but I'd like to hear from the rest of the group.
I think that's right, Stan.
Yeah.
However, my viewpoint, when we moved the hair salons and the gyms and physical fitness from 2 to 1, that brought me to the conclusion that there needed to be some additional specific requirements for that to happen. And so I think that's exactly what happened. But if they were still at phase 2, I wouldn't, you're absolutely right.
Okay. Tracy?
Just a couple of quick things. Speaking to the guidelines, I do know that there are some very specific guidelines for salons, cosmetologists, et cetera, that are in the process of being developed at the request of KDHE and the governor's office with a number of people within that industry. And so those should be developed fairly quickly, and we'll be able to link to those. And then I know we also have a number of people, here locally that have been working on some standards, and we can provide those certainly as additions to the appendix. And so I would just note that. To Julie's comment, as well as Commissioner Hanslick, under phases 3 and 4, as we look at loosening up our suggested guidance for seniors and vulnerable populations, I would also perhaps suggest the same thing based on feedback I've had on encouraging work from home. We may be still having employers who choose to do that based on spacing requirements. If they still are making arrangements with the type of real estate options that they have, if they are not able to appropriately social distance their workspaces, but particularly under phase 4, if and when that happens, when we're completely opened up, I wouldn't foresee that we would have to still be encouraging people to work from home. And so I think we could remove that language, or at least adjust it a little bit. Then, I think we've got some opportunity. I'm sorry?
In which phase would
Someone
you
have
like
a
to
question?
look at?
I think in phases 3 and 4, but I certainly would like to hear feedback from the group on that.
I would certainly concur in phase 4 that if we are opening everything up at full capacity, that modifying that language, and this is Julie with UCS, makes a lot of sense. And Tracy, if you've got some language for phase 3 that you think is getting us there, so we're ready to pivot to phase 4, I'm open to that language as well. And my only other comment in that column is the other question I've been getting from mainly faith communities, but from what we've been hearing from some of our other businesses, when we talk about gathering sizes, and this is another question that I would really like to hear Dr. Ariola weigh in on, is what is more important, the number of people that's appropriate and safe in a space, or how large that space is that allows for the distancing parameters, and that may be more than 100 people. So, but I definitely agree with the work at home.
Well, I think the spacing is really what we're after. Just to make sure we can keep people at least 6 feet apart when they are together for longer than 10 minutes. So that will be different depending on the space size. So to answer your question, distancing is the big thing. Yeah.
So can I ask a clarification on that? Would that also hold true for some of the larger venues like the hotel conference rooms, convention centers, et cetera, if they could appropriately social distance?
Yeah, I thought we talked about that. Was it yesterday? And I think the answer is yes. It's about social distancing. Yeah.
So I guess I just want to make sure where they fall then in the phasing. So would they fall with restaurants and bars, or they're all asking me questions about where they are, and or
Yeah.
I'm not sure what the answer to that question is.
Yeah, probably. I think that would be for this committee to do. I guess my comment about that yesterday is to make sure that we and do the rollback in a slow way and don't put everything in 1 and 2. But I don't disagree with your point as to where things need to be. That's what you have to make the decisions. But if we put everything that qualifies for 1 there, then that's a rather rapid and sudden ramp up. And so we have to balance those things out.
This is Becky. Just to tag on to that, then I think that at a minimum, I would like to see some distinction among the entertainment venues, particularly because we've got convention centers where they have the opportunity to social distance, you know, smaller groups very well, and we have them in 3. So I would maybe ask whether those could move to 2 with appropriate social distancing.
Reminded that we had a vote on some of that yesterday. What that is?
Well, I just, putting this together, I made sure and reviewed the video last night, and I think the discussion on entertainment venues, when I went back to leaving it as 1 column, and then what phase was it going to start in, and the vote of this group was to leave it in phase 3 as is.
Okay, I just think that ignores the fact that they can social distance really well in those areas, but that's fine.
Can I add something at this point, Joe? So Jeff Stewart, our Parks Director, now this is slightly different than entertainment venues. It may be applicable here, and I'm kind of the messenger, but this is the opportunity that's related, perhaps. He submitted comments about this is more for large sports complexes, aquatic centers, field houses, but it may fall into what you're talking about with convention centers, et cetera. He was recommending instead of the 100 limit, in phase 3, that a consideration for something that was brought up earlier about identifying a percentage of normal fire marshal occupancy load, or identify user zones and limit assembly maximums for those collective zones. I'm not sure if this is the right place to really insert this, but it could be relevant. I don't want to complicate it, but I told him I would at least forward that idea. Does it help?
Well, I think he was talking about.
I think they go hand in hand, Penny.
Was he not talking about the indoor swimming facility?
He was, but
for
yeah, it
the
wasn't.
Johnny Mason School District.
Yeah, he wasn't necessarily talking about entertainment venues, but the same concept about capacity, occupancy. And Tracy, I don't know if you cut out there.
Yeah, I guess Becky and I are making the point that the convention center, the conference room, the hotels are not entertainment venues. You know, they're not like sports arenas. So, you know, they're really more like, you know, large rooms in restaurants, but they can be subdivided and, you know, operate in a socially distanced manner. And so to lump them into, you know, entertainment, you know, like, or treated like the pools or community centers, I think is to do that a disservice. And so I guess I would respectfully ask that we reconsider.
Let me ask this question. The hotels are essential businesses
definition
already. And so if they practice social distancing, et cetera, in their facility, are they not already entitled to that, being an essential business?
Well, the conference rooms,
distancing guidelines.
but the conference rooms are already limited to meeting overrides. It's really only the rooms that can be open at this point, and and parts of the restaurants for carry out.
Chairman, I don't understand how we can say that in this scenario that whatever convention center can be open, because they will self-police, they will manage this self-distancing guideline, but we can't open public pools. We can't have the citizens going to get haircuts. We can't, there's all of these things we can't do because they can't be trusted, but somehow magically everybody at a convention center has the purest of intentions and would never violate it. That is completely contrary to everything I've heard everybody say so far.
Okay.
Commissioner Hanslick?
Thank you. I want to just, I think, make an overall observation that concerns me, and I would like to have Dr. Ariola's input. I'm hearing conversations that are continuing to push things up in the phases, and certainly the intent of this is to phase things in, and so that we can maintain some control and some oversight of the spread of the virus. It's not going to be 100% perfect and equal because it just can't be. Otherwise, everything would be in phase one. And I'm really concerned. For example, I only see two differences between phase one and phase two. And those are in phase one, the restaurants are at 50% occupancy, and in phase two, 75%. And the only other difference I see is that massage services can open in phase two. Otherwise, everything is exactly the same. And I'd like Dr. Ariola to have the opportunity to talk about what is that enough of a difference to even have a difference between these phases? What looking at it from a broader point of view, what do we need to be thinking about to ensure that the phases are going to be effective?
Thank you, Commissioner. I would, so my role is to really reiterate what we can do to protect the health of the public. And a lot of what we are doing, they're not exact science. We are trying to balance things and juggle them. We know that we want to keep physical distancing measures. We know that we can't pretend like the past 6 weeks did not happen, because again, the reason we are where we are with our numbers tracking down is because of shelter in place and physical distancing measures. And so as the community decides to start rolling things back, my recommendation remains the same, is there's a lot of things that can probably fall in multiple phases. Perhaps a lot of things can fall in phase one, but then if you, for lack of a better word, overload the system again, where you have a lot more interactions and you have a lot more people out there, the risk of having to go back and reinstitute more stringent factors is higher. Again, we don't live in isolation. We have other counties and cities that are neighbors to us. And there are people that are moving back and forth, which by itself, once we open things back up, that's a bigger risk. And so as you make your decisions, even things that can fit in the earlier part, let's try to give ourselves enough time to adjust to the first phase and then increase that gradually in the second phase. But you are right, if there are additional things that needs to open back up in phase two, after we've done phase one and we're comfortable that people are still taking steps that we need them to, and the data is not tracking in the wrong direction, then maybe there are things you can push to phase two. But again, just looking at the chat and listening to the comments, and I know it's a lot of pressure from the community. Everybody wants everything to open back up in the first phase, and that's just not very good for the health of our residents.
So let me,
Excuse me, Chairman. Could Dr. Ariola restate that last sentence?
Opening up everything at the same time will increase the risk of exposure to our residents.
The one thing we should keep in mind is this phasing allows the public health department to make judgments along the way as to whether or not we are continuing to be successful. Heaven forbid that we should have to go back after a couple of weeks or 3 weeks and have to reimpose a stay-at-home because our numbers are advancing. And so that's an objective that we need to keep in mind, is that this phasing allows us to make those judgments as we go along, that we're not reverting back to where we were in the past.
Thank you. Commissioner Brown, do you have additional comments?
Yeah, but I'm going to hold him. I'll hold on to that. I'll stand down. Thank you.
What about Mayor Michelson?
Okay, I just want to go back a few comments ago. I think Chairman and Stan both touched on this, but the gyms with restrictions and the appendix in terms of holding, you know, the universal precautions to prescribe that they follow best industry practices, but then what those practices are primarily left to industry. I do think, and maybe these came from you, Scott, or somebody, we saw some good guidelines suggested for fitness facilities and gyms. I just got a new set, which upon scanning looks even more restrictive, that a fitness facility in Prairie Village Fitness 2020 is prepared to do anyway. And if we need an appendix for that category, I'd be happy to submit that just for the record. That's number one. And then number two is, as far as the conversation between Commissioner Hanslick and Dr. Ariola, I hear that, and I'm very sensitive to that concept of overloading the phases. And here's how I get comfortable with where we are right now. Number one is, it's not just pressure from the community, the economic community, to open, although that's big. There's also, in my mind, a fairness and a consistency standpoint. If you're going to tell a restaurant they can open with these severe restrictions, I have a real hard time telling a gym that they can't, or some other business that, by all the science and medical analysis that I'm seeing, including the Johns Hopkins report, has a relatively equivalent risk level involved with it. So that's part of it. It's not just a pure economic pressure, it's a fairness and a consistency consideration as well. Now, all that said, the only reason this works is because that trigger for when we move, you're going to know what the phases are, Dr. Ariola. You're going to see them. We're going to presumably vote on them here soon. And you're going to be able to tell us, or at least make your recommendations. And now we have language in this report that we want the commission to follow your recommendations as to whether and when we're ready to move, when those gating criteria are met, mindful of what that phase looks like. So I get comfortable with these phases because those triggers of when we move either direction are going to be hopefully in your hands.
Julie?
First of all, I appreciate Commissioner, the chair's comments about concern around why we're having the phases and the ability to manage. And Dr. Ariola's, I think, spelled it out very clearly that we have to be mindful. This isn't going to be perfect, but if we overload the health department's ability to manage the phasing and the testing and the measurements, then we've really defeated the purpose of phasing in the first place. I did want to make one clarification. In the governor's executive orders, hotels and motels fell under housing. So it was really contemplating making sure that there were spaces that people could shelter in place, and recognizing for some that was accessing hotel rooms. So I really don't think it was speaking to meeting space, more of that. And then finally, Frank Link had sent out earlier today a thoughtful piece on looking at some of this, recognizing that we can't be equal for everyone at the same time because we would overload the system. So asking ourselves different risk factors, and I do appreciate that we expect everybody to self-police and to make sure they're doing the distancing and those rights of self. But we also have to recognize that, once again, it's going to be in unstructured settings. It's going to be harder and harder to forget, in my case, 50 some odd years worth of habits of wanting to go over and say hi to somebody or start to interact over that course of time. So if we have opportunities in our early phasing to think about how easy it is to make the modification, how big a change it would have been from a prior practice, or what's the risk of falling into old habits. I think those are good kind of guidelines to be thoughtful of. Certainly a restaurant modification of being able to seat every other table to ensure that. I mean, there's some things that are just easier to create a framework on than more of that comparison to what Commissioner Brown said yesterday about his thought when he was thinking of pool openings was more of the interactions that could happen at the pool deck more than the safety of the water. So I think that's we're going to all be creatures of habits. And I think that's just a reality and something we need to be thoughtful in as we think about phasing and those safety factors.
Scott Anderson.
You know, I'd just like to make the point that I'm kind of surprised we've spent hardly no time at all talking about the guidelines. Commissioner Hanslick made the point that, well, when you look at phase 1 and phase 2, everything's the same except massage parlors. And in my mind, that's not true. I thought the whole purpose of this was to have guidelines so that as we move to phases, more people could come out, more people could go to restaurants, more people could go to businesses, more people can go to gyms. And the lack of I've tried. I've sent around guidelines on restaurants. I sent around guidelines on gyms. I've gotten no feedback really. We're putting out standards that have no guidelines. And I mean, if we see this final report and it says, hey, the guidelines for hair salons are 1 chair per 10, then I'm going to say, well, did we really open hair salons? Or if it's 1 chair per 2, well, maybe did we open them up too much? So I think, I'm just for the record, I think we've left the substance out of our discussions. I mean, the substance is the guidelines, and we've had no conversation on guidelines at all.
Let me just try to address that, I guess. I'm hearing 2 different things from some of you. I'm hearing some say, go find guidelines that exist in other places, include them as a suggestion or in the appendix.
And they can change.
And then businesses it's up to the business end to go through and figure out, okay, this is the current one, I'm going to do more than that.
I made this.
But then I'm hearing you say, Scott, we should be prescriptive on some and say square foot ratios, number of tables per square foot. Now, so I guess I'm just trying to figure out what are we supposed to produce here? Because I mean, I think that I'm hearing kind of 2 different things. And to your point, I apologize for not responding to your email. I have gotten them. We are starting to put those things together. You just don't have it ready for today, so I apologize for that.
No, and I didn't mean anything negative by that, but I said this in an earlier meeting. I'm a firm believer in letting certain businesses follow industry norms, industry practices. And that, Commissioner Brown made the point earlier, and Stan, it was a great point. But I made the point at a meeting 2 meetings ago, I think, that it's important to have those customer-facing businesses, the restaurants, the gyms, the hair salons, some of those on the front line with their customers. Look, I don't think we need standards for the large companies we have in town. Or the small bit offices. I mean, they're going to comply with what they need to comply with. But these businesses that face customers, I think I'm not a fan of rules, and I'm not a believer in imposing a bunch of rules on a business. But I do think in this instance, there's going to be a lot of pressure to do what your competitor's doing. I mean, and if we don't, as a business owner, it'd give me some if the standards are reasonable, it'd give me some comfort. Look, let's play how we should. Let's follow the reasonable standards. I think that's a big, I guess I thought going into this, that was kind of a big part on what we were going to do, was establish some guidelines for these businesses that are opening up first.
Okay.
Mr. Brown, your hand up?
I do. So following up on what Mr. Anderson just said. So from the get-go, when we first started this, literally within the first 10 minutes of our very first meeting, I asked the chairman what the goal and the objective of what we were setting out to do. What is the goal of this task force? And it is my recollection that I recall the chairman saying that it was to provide some basic structure for how to reopen our economy in a phased and reasonable manner that keeps the risk low of a spike in infections and back to the whole flattening the curve, the ICU usage. That said, that's not at all what this document is. This thing is so convoluted. It is so twisted. It is so deep in the weeds that people aren't going to follow it, guys. People are not going to come back to this and follow it. They're going to do what they think is the best thing to go do. That's what's going to happen. This is so far off in the weeds. Nobody's going to come back to this document. They just aren't. They just are not. This whole thing is gone so far into the weeds. We're splitting the hairs about what lane should someone who puts on eyelashes versus someone who cuts hair versus someone who, it's just so far, this just seems like an absolute exercise in futility, because I just honestly believe that by and large, the business community isn't going to use this as a resource at all. Thank you.
Chief Reddick?
I was just going to add, I think we're minimizing the impact of the left column. That's going to be consistent throughout the document. I think if Johnson County is going to be successful, it's because we're going to continue to socially distance. People are going to wear masks. Our most vulnerable populations are going to take care of themselves and try to get themselves out of trouble. The rest of it, and to Commissioner Brown's, I thought that was the only detail we were supposed to get into, what businesses we're going to open and potentially when. And I think we're close. I think we can get this there, but I do get real concerned when I start talking about business operations. So how often are silverware supposed to be cleaned in a restaurant, or how often should a nail salon be cleaning their equipment? We can't do that. We have to trust that they're going to be able to do that. And anyway, I just wanted to throw that out there.
Yeah.
Thank you. Go ahead, Chairman.
Go ahead.
Mayor
Michelson?
Yeah, thank you. I want to agree with the chief and, respectfully disagree with Commissioner Brown. When you described the mission of what we had at the beginning, I think we've done that. And I think we've done a good job of that. Is it perfect? Absolutely not. But is it perhaps as perfect as could have been done, under the time frame that we have and all these competing pressures and tensions and considerations? Well, I think it's at least a B+. Do we have a lot more work to do? Well, there'll be a lot of questions, including perhaps on fleshing out these appendices, to your point, Scott. I believe so. If we had another day, maybe that's a day of working on the appendices, because we've completed now the text, we've completed the grids, or at least are close to it. And maybe that's a third step for another day by us or some other body. But, when you stated the mission, Commissioner Brown, which I agree with, I think we've hit it.
Well, there's an old saying, making sausage sometimes is a long journey, but I would say, I think generally you all have done a pretty good job, and this is it's not an easy task. That everybody knows that, and there's all kinds of different ideas as to what should be done in this instance or that instance, or this business or that business. But I think you all have done a good job at this point. It seems to me like the question is then, in the appendix, that would, do we want to go there? Do we want to leave it alone? What's the thought?
Chairman, this is Julie with UCS. I think unless we were ready to make a much, much larger committee, I would not be comfortable getting into too many specifics by industry. That's my understanding of why we were doing the appendix. I do appreciate Scott's comments and concerns about, do we have enough guidelines that dip into some of those areas of concern. And is there a way to split the middle? But I don't think we can go into the weeds too far because there's not enough industry experts for every industry that we would be encompassing at this table.
You know, I would go back to a comment that was made earlier, I think by more than one of us. And that is the restaurateur who said, you know I'm going to have to do things that make my customers feel comfortable and that it's safe, or they will not come back and they will probably destroy me on social media. But having said that, I think there are those general guidelines, 50% business or 75%, whatever it is, and or of occupancy, spacing tables and chairs for the 6 feet. That's where I think we need to be, quite frankly. And Scott, I know this, and there are other industries that are already working on, practices that would comply with those general approaches. And so anyway, my thoughts.
Mr. Brown, your hand is up.
So just want to circle back on my previous comment. I feel like this is very much in the weeds. I feel like this document is a textbook example. And I want to say, let me back up just for one moment. Everyone on this committee, there have been times, most of you I've met, some of you may have heard about me or think you know something about me or have a preconceived notion about me, but I want you to know about you. I have come to respect everybody on this call at a much greater level than before this call, than what I knew or what I thought or what someone had told me about you. And whether that was good or bad, I have now my arms around who each of you are, and I have a great respect for the fact that you have invested the time on behalf of Johnson County and the citizens and the people that we all represent, whether that's as an elected or whether that's as a head of a company or a group. So that said, we have wandered into nanny state at to the millionth power on this. This is not at all what I understood we were lighting out to do. And I can't even remember, it might've been Mayor Mickelson, as you had said. I respectfully disagree with your assessment, and you're entitled to your opinion, and I am too. And so from that perspective, I feel like we have wandered so far into the weeds. We have spent, I don't know, what are we at? 15 hours now, 12, 15 hours. And we've created a document it's a nanny state. It's us telling the restaurant business and the hair care world and all of these various retail and nail salons and gyms and sports venues, and we're telling them how they're going to run their business. And there is not one person on this call that knows more about each of the individual businesses in every one of those lanes than the people who own that business, operate it every day, and securitize it with everything they own when they signed a loan. And I just feel that we are we have way overreached on this document. Thank you.
Well, let's go back to the beginning. There were 3 or 4 documents that we chose to look, evaluate, and use as a guide. One was the White House document. Second was the John Hopkins document. Third was the U.S. Chamber document. And fourth was the Nashville document. We have incorporated aspects of all of those documents into our plan. And I think that's a good step forward, quite frankly. We can disagree on specifics, but I think that job of evaluating those important documents and incorporating what applies to Johnson County into our document certainly is appropriate.
Commissioner Hanslick?
Thank you. Yes, I have to say that there are, in some aspects, there are things I agree with Commissioner Brown in regard to, I am not an expert in these various industries, nor do I want to be. But given that, I know that a lot of businesses are asking for some guidance. What are you talking about when you mean guidelines? And I guess what I envision as an appendix to this this grid is something that provides links to the industry standards, like the National Restaurant Association or whatever it might be. And if there isn't anything that is existing in the industry, then have a kind of a brief overview. And I know Mr. Anderson has supplied some of that for what we're meaning, but I don't think, at least I can only speak for myself, but I was not envisioning some huge document with pages and pages of regulations, but more of a resource. Here's where you can look to go for your industry guidelines, or here are the things in general that are the kind of guidelines that other people in your industry are using. But I would never want to presume that I could write guidelines for each of these industries. But at the same time, I think they are expecting some kind of information when we talk about guidelines.
Yeah, and that's similar to the John Hopkins chart, if you remember. It had a column with resources with links, and so we can certainly head down that path. Again, okay, so Tracy?
Thanks, Joe. I just want to make it clear that what we have heard from businesses all across the county is that they do have an expectation of seeing what some guidelines are. So the universal guidelines that we are providing, I don't believe are onerous. And at the same time, not every business has access to association guidelines. They may be a very small business and they can't afford to belong to one. They don't have access to that for whatever reason. And for that reason, I think it's incumbent upon us to try to provide, whether it's through the Johns Hopkins pieces or like the restaurant guidelines that Scott drew up, and the cosmetology piece that I referenced a little earlier that KDHE is putting together. We're not going to be able to do that all across the board for all industry sectors, but for some that we know that, especially those that are opening in those early phases, those are the ones that we need to provide a little additional guidance. We've heard that from every single one of the chambers, that their small businesses are saying, just give us some suggestions, help us along the way. The big businesses, the chains, the office market, manufacturing, they've got resources. They don't need us to tell them what to do, so we don't really need to waste our brain power on that. But the small business sector really does, and they can benefit from those best practices. And I don't really see it as us telling them what to do. I see it as providing guardrails that give them ideas about how they can safely run their business, to keep their workforce safe, and also to keep their customers safe. And so, I'll help provide whatever members are providing us their own guidelines and give those to Joe if they're willing to share those, and then help provide those from other national associations just as quickly as we can.
I have to do just a kind of check in with where we're at, and I'll pose the question. We've been at this for several days and several hours, and everybody is invested, and we have heard a lot of great input, and I think there's a document that we should feel. I know it's messy because there's no easy solutions here, and there's a lot at stake, but it feels like we may be closer to the point of saying, okay, this task force has worked it to this point, and if there's any last things that you feel like you really need to get said to the group, then we do that today. Otherwise, perhaps we're getting close to a point where the task force could feel comfortable with, we have spoken, we've given our input, it's now time to turn it over to the county. And I'm raising that question because I'm not sure what more can be done between now and we need to get moving within a matter of hours and days. Just posing the questions, kind of checking in.
Scott, you think your hand was up?
I'll be very brief. When I talked about standards, I'm not talking about telling businesses how to run their business. Our standards are occupancy.
the standards are in place to control occupancy, to control the numbers of people that come back out. Those are the standards I'm talking about. I
Right.
just wanted to clarify that.
Right.
Okay, Commissioner Brown?
Thank you. So I would submit that if we were looking to a template as a guide in total, as opposed to a combination of, I don't know, I think Chairman, I heard you mention 4 or 5 different documents that we've pulled from and cherry picked from, I would submit that a really solid document to have worked from would have been Governor Parsons from Missouri's document. That gets really close to what I'm talking about and doesn't get down into the weeds. It lets business owners account for and atone for themselves. When we talk about what would have been where should this have gone? What should this have been? How should this have looked? In my opinion, this should have been summarized. The entire document could have been written down with 7 bullet points, and they would have started with 1, keep away from folks you don't know. 2, don't shake hands. 3, keep away from large groups of people. 4, if it feels unsafe, then stop. 5, if you think you have met the best practices guidelines for your industry, then proceed, but do it with caution. 6, if you have a health concern or are sick or elderly, you should stay home. And 7, carry on. We're Americans and we're Kansans. We don't need government telling us that we can or can't open our business in a certain fashion. Thank you.
Okay, appreciate that viewpoint. Going forward from this point, do we want to spend any time today on the appendix and the guidelines that might be there? Or should we rely upon industry as well as state requirements in that regard, whether it's a licensing organization, regulatory organization at the state level? As I look at it, the requirements we have put in place are for restaurants, a certain occupancy level, distancing, separating tables, etc. For hair salons, what we talked about was, again, every other station to be occupied, providing protective equipment for the care providers, and clients staying in their cars and coming in with a cell phone call. Gyms and physical fitness, again, based upon an occupancy requirement, maybe 50% occupancy, and distancing the equipment and the workout activities that occur. Going beyond that, it seemed to me like encouraging folks to take protective measures out in public and distancing, masking if they desire, and all of those features are what we've been talking about to incorporate into this document. And if we want to go beyond that to set up standards in an appendix, then I think we need to reference either industry, state requirements, that kind of thing.
Okay. Mayor Michelson?
I'm not trying to cut off discussion if there is any, but for purposes of where we are on the timing and our scope and mission, I would move that this task force recommend the text draft and the grids with the modifications and amendments that we've approved today to the Johnson County Commission, with the caveat that the appendices are yet to come. And I would encourage, to your point, Chairman, that we go with the industry standard references supplemented by Scott's good work, and maybe even Scott and Tracy and others might be willing to work with Joe, who's done such a great job with us so far in putting together the final document if this motion passes, including appendices for us to review maybe tomorrow or whenever it's ready.
We have a special board of commission meeting tomorrow to review the document that's been presented or will be presented. That's an informational meeting. And then Thursday, we have our regular meeting, at which time the Board of County Commission will be requested to take action on this document. So I don't know that we have another day to proceed. And part of that is in consideration of May 4th, May 3rd is just a few days away. And so we need to be prepared for that. Don't know what the governor's going to do, and but that's kind of the timeline. So you made a motion. Do you want to clarify any part of your motion?
Yes, Chairman, thank you. In response to your good comments, I'll clarify, I'll leave off the timing part. And the motion is just to approve these first two segments that we've amended today, the draft called the Johnson County Recovery Plan and the accompanying grid, with the understanding that the appendices will come, and I'm not going to put a timing on that, but just that may be before or after or in conjunction with the commission, but probably not by another meeting of this body. I would just approve the first two sections would be the motion, Chairman.
Okay, well, I think we probably need to, in that motion, that the Board of County Commissioners will have the final, or provide the final review of any appendix. Is that appropriate?
Yes.
Mayor?
Yes.
Okay. All right, is there a second to that motion? Excuse me, let's ask if there's a second.
I would second it. This is Julie Brewer with UCS.
All right, there is a second. Julie, did you have a comment?
I do have a comment. With much respect to Commissioner and Vice Chair Commissioner Brown, I do disagree that we've gone down rabbit holes or we've come up with a convoluted document that no one will follow. I know in the days, and it's been days, that we've all been around this table, we've increasingly been asked and given input from the broader community. And as I have sent out or directed people to the different phases of this document, I have received a number of emails thanking me for pointing them to the document. It had helped clarify a number of questions that people have had. My expectation of service on this task force was to give some broader guidance and insight primarily to our health department, who's really tasked with helping us understand what is a safe phase-in of returning to reinvigorating our economy during this difficult time. And I feel very comfortable and really look to Dr. Lemasters and Dr. Areola to, if their comfort level is strong with the document, then my comfort level will be strong with the document. And I just wanted to respectfully give my perspective on this process and what my interpretation of our role was in this process. Thank you.
Okay, thank you. Other comments? Chief?
Yes, I would just to say, I know we've got a motion that we're considering right now. I'm just going to say that I'm going to vote no on it and throw out for discussion. I would be willing to move forward with this, but without any mention of appendices. I just don't think that's our business to get into that. I think this broad document that we have in front of us is all I'd be comfortable voting for.
Okay, all right. Other comments? All right, if not, the motion is before us.
Pardon? Ask the mayor if he's willing to amend his motion.
Mayor, did you want to take that into consideration or leave your motion as is?
Certainly, I'd take it into consideration. Chief, if I may ask you a question, if we leave appendices out of the motion officially, are you intending that there would be no appendices, or we would just leave that entirely to the commission?
I just think as for this body, I don't think it's our business to get into the appendices, and to be blunt, I'm not sure that we should go beyond that. And I think I'm speaking out of turn here a little bit, that we just in general as the government should, and the board should. I think it's enough. We worked before the process we had before, which we referenced earlier. There was none of that involved with it. In fact, the health order basically just provided some relatively broad, it decided what businesses were going to be open And then it went so far as to talk about the social distancing and those type of things. And went so far as to say making hand sanitizer available and things like that. I think to get into how the businesses are operating, that just it sits a little bit wrong, and I just think it goes a little bit too far. And I almost think if we're going into those, if we're including that in our document, then we're saying that without researching any more than what we probably need to, we're saying that we're good with those industry standards are. And I still think there's going to be a lot of work in making sure that's what we want to do. And I just like I said, I just think it's a long road to go down. I think we've talked about that before. I trust that the businesses are going to do the right thing. I just do. And if they're not, the health department can step in at that point, or the social media component can step in at that point, but it will happen. There will be ramifications if businesses aren't doing their job the right way.
Yes, there will, most definitely.
Okay. All right, Mayor?
Well, I would certainly amend my motion. I mean, you know, in my mind, I would like to see some appendices, but I'll remove that from the motion because I think it's important that we approve the draft document and the grid if everybody's comfortable with that. So I will restate my motion to approve the draft document.
All right, well, let me ask the
grid.
second. Julie, would you agree to that retraction?
Quite frankly, I would not. I never looked at appendices as a requirement or a must-do. I looked at the appendices as examples of best practices or guidelines within different industries, and this as a service, by having the appendix as a service of providing those nestled in one location for easy reference.
All right, well, I think perhaps the procedure would require an amendment to the motion to remove the appendix reference.
May I ask a question?
Sure.
So of the chief. So is your concern that by containing the best practices or guidelines within the document, that implies or infers an enforcement of guidelines that we haven't fully vetted, or by extension, the Board of County Commissioners hasn't fully vetted? So if we wanted to still provide guidelines or best practices, as Julie is stating, and as we've kind of talked about, if those resided in a separate document as reference, would that satisfy your concern? And I think still our intention, which is to provide opportunities for businesses to have something to look to for a best practice and provide guidance. But if we separated the two pieces, would that give you comfort from an enforcement intention to not rehash that whole conversation that we've already had? But that way we could still have overall agreement on this document to send it to the board of the grid and the word piece, and then have the appendix be just a separate, you know, here's kind of an FYI that everybody can look to for guidance.
I think that's a great idea. I think there is a place for that. I'm not exactly sure that this is the place for that, the reference sheet that, as you mentioned.
Okay, so that could just be a staff generated document, and those of us who can assist with that, I'm happy, Joe, to help you and the team with that. And but that could reside separately if Mayor, that could be part of your motion.
Okay, well, we procedurally, we have a motion on the floor. If we want to amend that motion, let me hear an amendment.
So moved.
Amendment is to reduce or to eliminate the reference to the appendix in this report. Is that right?
May I make an amended motion that I think captures the conversation that we're referencing wouldn't be an appendix.
I don't remember all of my parliamentary procedure, but it seems to me we can go ahead and vote on the motion that's before us. If that's rejected, then we can have another motion. Or we can amend an offending part out of the motion, vote on that. So why don't we do so before we take another motion, unless the maker just wants to completely withdraw his motion.
Withdrawn.
All right, so withdrawn. Ms. Brewer?
Then I would make a motion that we pass the document as drafted with the edits that have already been discussed, and that the guidance document simply becomes an exhibit, not an appendix, just to demonstrate in an easy reference where people can find that information.
Is there a second? I'm trying to understand the difference between an exhibit and an appendix.
I would second with the clarification, Julie, that your motion includes adopting the draft and the grid, but what we've been calling the appendices would be the separated thing.
Correct.
Okay, I second that motion.
Okay, the motion has been made and seconded to adopt the documents as noted. Is there any further discussion?
Yes, Chairman, I have my hand up. I will comment that I struggle with this entire document. I struggle with the nanny state we've created and my concerns about civil rights of those who this would apply to, and my vote will reflect that. Thank you.
So noted. Other comments? The motion is before us. Clerk Joe, call the roll.
Chairman Eiler,
Aye.
Commissioner Brown,
No.
Commissioner Hanslick,
Hanslick, yes.
Scott Anderson,
Scott is yes.
Tracy Osborne Olchin,
Yes.
Mayor Eric Michelson,
Yes.
Becky Yoakum,
Yes.
Julie Brewer.
Yes.
Stan has left the meeting, so Chief Troy Reddick.
Yes.
Okay, thank you. I believe that.
All right, the majority is yes, so the motion passes. Is there anything else we need to attend
Yes,
to?
yes,
today?
there is, Chairman. I'd like a count on that, please. What were the yeas and nays?
Well, there was one nay, and I've got, the rest of them were ayes.
I want to know how many that is, Chairman, please. Thank you.
All right. Thank you. Any other comments?
Yes, Chairman, I haven't gotten my question answered. I asked specifically how many yays were there?
Hold on a second.
There's two missing, right? Two absent.
There were 8 in favor, 1 opposed, and 2 are absent.
Thank you.
Satisfied?
Yep, that'll do it.
All right, thank you. Well, let me say this again. Thank you all for your contribution to our effort, to your patience, to your wisdom, and let's hope we never have to do this again. Again, thank you all very much on behalf of our county and our community. Good job.
We will see you from the Board of County Commissioners meeting. Have a good evening.
Thank you.
Thanks
Thank
to
you.
Joe.
Yes, thank you, Joe.
Lots of midnight oil to him and the team.
You're very welcome.
I have one question before everybody leaves. Are you, since we have the board meeting tomorrow, are you wanting representatives to be able to be there, or thoughts on that?
Well, that's up to them, whatever they want to do. Obviously, you'll be able to observe it. We do have 3 members of this group who are on the board, so unless there's someone who wants to volunteer to make a specific presentation, if so, you're welcome. I don't see any hands up. Okay. All right. Well, again, thank you very much.
Thank you.
Thank you.
Good night.
Bye.